Hey, what's up, class? This is Andrew. My concept map today will be on ulcers, so duodenal ulcers and gastric ulcers, some underlying reasons for those, specifically H. pylori, and another condition in our intestines, which is diverticulitis. So let's start off with duodenal ulcers. So this is located in the lower GI, as you can imagine, because it's your duodenum. Um, so it has a wide range of incidences. It really covers a big age range. So that's folks from in their 30s to 60s. Um, there's there's a hypersecretion of HCl. Patient experiences during these ulcers is they actually gain weight. There's like a burning sensation in their abdomen, like about 2 to 3 hours after a meal, um, which makes sense, right? Because it takes time to get all the way down to your intestines. Um, so in duodenal ulcers, there's also less hemorrhaging than with stomach ulcers. It's more likely to perforate, and malignancy is pretty rare. Um, so gastric ulcers, that's kind of the upper GI, right? Imagine your stomach, so it's a little higher. Um, so there's a more of an incidence in older folks, let's say around in their 50s. There's normal secretions, and patients who have these type of ulcers actually experience weight loss. Um, the pain and discomfort is pretty quick. It's about half an hour to an hour after a meal. It can be relieved with some vomiting. It makes sense too, right? Because this is your stomach and your food. It basically takes that long to get down there. Um, so, ingestion of food may increase with the pain. Vomiting is common, and hemorrhaging is possible. There's some general risk factors, some common ones associated with both these type of ulcers, and those will be alcohol, smoking, and stress, and specifically H. pylori. So H. pylori is a bacteria. Um, so just taking a step back. So ulcers occur. So ulcers, especially in our stomachs, pylorus and duodenum and esophagus, they occur when there's an erosion of the mucous membrane, and it forms like an excavation of that mucous membrane. Um, these erosions are directly associated with H. pylori. H. pylori is a bacterial infection that is treated with a combination of medications, um, a minimum of 2 antibiotics, and a anti-secretory medication. So those are beta lactams, such as amoxicillin. The antibiotics are clarithromycin and tetracycline. And there's also Flagyl. And again, 2 or more antibiotics are given at the same time, along with like maybe like a proton pump inhibitor or something. So the two ulcers, so gastric ulcers and duodenal ulcers, the key component of the cause there is H. pylori. Um, Unfortunately, chronic peptic ulcers or chronic, peptic ulcers will lead to peptic ulcer disease. I think that sounds right. Yeah. And that will actually, if that continues, that will actually most likely lead to actual gastric cancer. Um, so, so with cancer, there's masses that grow, and typically the cancer in the stomach is typically examined in the epigastric regions. So it's gonna be, your epigastric area is like right there. Just moving on to diverticulitis. So diverticulitis is defined as an inflammation of one or more of the diverticulita. Um, fecal material or undigested food particles may collect in the diverticulitum, causing an obstruction. So imagine like your intestines, right? And there's going to be like an outpouching that forms So that's not really normal, but when that forms, that's called diverticulita. Dive no, diverticula. Um, so attach itis to that. So that's an inflammation. So diverticulitis is the inflammation of those little outpouchings. So the obstruction may result in a distension of the diverticulita, increased pressure of food particles in those pouches cause erosion of the wall, resulting in inflammation. Um, Diverticulita is caused by stress, congenital wall weakness, low intake of fiber, and just straining during defecation. Signs and symptoms of diverticulitis is abdominal cramping, nausea, vomiting, constipation, diarrhea, flatulence, bloating, and just some symptoms of like irritable bowel syndrome. Like it could be, you know, diarrhea or even constipation. Dietary management of this condition, basically, as I said before, it could be caused by a low fiber diet. So managing this condition could just be increasing your fiber. So I think that's all for now. I can switch you back. Actually, no, I think we're good. All right, thanks for your time, folks.